for being on here. And for the media, this will probably be a kind of a fluid discussion. I'll call on some of the task force members to speak to some of the items on our agenda. And then at the end, we will certainly let you all ask questions. I hope that you will have that capability. So today we want to give really an update of the entire kind of an overview of the city and the county on how we are, where we are presently with the COVID virus, and then also a number of new announcements that are the result of the recovery task force. So I'd like to open it up by letting Joe Pruitt and Dr. Smith and Dr. Monarch kind of give us a countywide health update, if you would, please.
This is Dr. Monarch. I'll go ahead and start, Mayor. I would like to thank the mayor and thank Dean Watts for all their support throughout the last 6 to 8 weeks from here at the hospital of Flagey. Their input has been invaluable in helping us to prepare for these issues and to deal with the reopening of our healthcare system here in the county as well as the state over the next 4 weeks. So kind of a brief update. Starting last Monday, April the 27th, the governor opened the phase 1 reopening of healthcare, and that was for diagnostic procedures as well as in-person office visits. So that has now been going on for the last week and a half or so. We have seen a steady increase here at the hospital of our diagnostic radiographic imagery, which has been great. We are now starting this past Wednesday, May the 6th. We are in the phase 2 reopening, which that entailed the beginning of elective outpatient surgical and invasive procedures throughout the hospital as well as the state. That includes pain procedures, outpatient elective surgeries, as well as any outpatient diagnostic procedures as well. So that has been going very well. Our surgical volume, we've seen a very nice increase over the last 2 days. This is the third day of that. So we feel that here at the hospital, we have been very conscientious to work with Dr. Stack and his people at the Kentucky Department of Public Health in terms of meeting the expectations that were set forth by the governor in terms of what was required by the hospitals to reopen or start reopening our services. A big component of that is ensuring that we have a 14-day supply of PPE on hand at any given time. And at the St. Joseph system, which is based in Lexington, they have been a great partner with us or a great company in terms of ensuring that we have that proper allocation, whether it was here at Flagey, if we needed to divert from one hospital to the other, that we could meet those expectations, and we are doing that quite nicely. So we have our well supplied and our PPE is here. Also like to note that over this is day 3 of our elective outpatient procedures. Compared to the other hospitals in our system, Flagey has had a 0% no-show rate for our procedures. So what we're seeing across the healthcare system is that people who are being booked for surgeries and booked for outpatient procedures, the rate of them not showing or canceling last minute has been pretty significant at other hospitals throughout the state. And as well as our own healthcare system. So Flagey we've seen a 0% cancellation rate in that. So I think that's important because if you look, I was on a call this morning with the Kentucky Hospital Association, and they threw out a number that there's up to 70% of the general population who still have some anxiety and apprehension about seeking care in the healthcare systems and hospitals. And there's going to we want to make a big push to the population that we feel that it is safe that people do enter our buildings. We are working very hard to do everything that we can to protect our patients who are seeking our services, as well as the staff and the physicians here, such as doing temperature screenings for every person entering the building. from patients all the way through to physicians, as well as asking for for symptoms. And if anybody does kind of screen in that way, they are asked to leave and seek medical care and to receive the testing, which we are now easily able to do for those people who we need to test. So that is all going well. We want to encourage people to not delay the seeking of medical care. One kind of final note, I just kind of want to reiterate to people right now is per the governor's instructions, we still have a no visitor policy in our facility. We feel that the governor feels, and we agree with that we feel that this is just an extra layer of precaution that we can extend to the patients as well as our staff to decrease the potential spread of the virus if somebody is asymptomatic and is potentially shedding that. So we anticipate that to not last indefinitely. There's been some initiatives with the Kentucky Hospital Association drafting some recommendations that are being presented to Dr. Stack and the governor over the next week or so in terms of how do we relax that slightly. So I do think that over the next weeks to months, we will see a relaxation of the visitor policy such that one visitor may accompany patients into the hospital, whether it was for a surgery or just to get a chest X-ray. So we think that'll be coming. So be looking forward to that. So that's kind of our brief update, and I think that we'll entertain questions at the end of the conference.
Okay, thank you, Dr. Monarch. Joe Pruitt or Dr. Smith, would you all like to give your update?
I'm going to let Joe speak more to the EMS, but very briefly, our main concern has been the protection of our personnel and with PPE, which I think have been managed to get on top of that. And from the physician standpoint, the different practices in town that I'm in touch with, I think that the PPE is at an adequate level at this point. We're going to great lengths to see our patients safely, and we're trying to even see the kids that need to have immunizations to keep them from lapsing in a different part of our office, completely different part of the building, in fact. But that's just very briefly where we are with it right now, and I'll let Joe speak to the EMS specifically.
Thank you, Dr. Smith. Joseph?
Yes, sir. As of today, we continue to reach out to obtain additional PPE supplies for our first responders throughout the county. We're in pretty good shape today. We're going to Louisville today and pick up an additional donation to us from another group in Louisville. So we're standing at about 7 weeks based on our burn rate, 7 weeks in our supply. And that's been pretty continual with what we've been able to bring in to offset what we are using. As of today or last night, 30 patients or 30 positives in the county, 5 in the last 24 hours. 1 is hospitalized and 6 are in quarantine. Unless there's any questions, that's be what I would have for today.
All right, thank you, Joe. I'm going to give a quick update on the earlier initiatives, the small business grant program. Of course, we announced earlier this week, we had 95 that were eligible. We're distributing literally as we speak. The checks are going to be going out today. We're going to hand deliver some of them. We'll probably have to mail some of them because some of the businesses aren't open, but $120,000 end up being our number that we were able to distribute. And hopefully that will be underway today and probably a little more aggressively on Monday. The Tri-County United Way, if you remember, the city contributed an extra $20,000 to that project. And in addition, there was $15,000 from the private sector that supplemented that. They have made their decisions on the recipients, and I think those recipients received their grants this week. So really the first phases of our efforts are already kind of pretty well getting completed this week. And so the private grant or the grant part of the things, we end up with about 55,000 from the private sector to go with 65,000 that the city put up. So it's a great public-private initiative. Now I'd like to call on Kim Houston to, this is more new information to start sharing with you all today, is about our recovery task force. So Kim, if you would mind, give your report out on that, and we'll get into those particulars.
Absolutely, Mr. Mayor. Thank you very much. You know, when all the closings started, we were very quick to put a Nelson County Recovery Ready Task Force together. That task force was made up of what we call some of the brightest minds in Nelson County. We had our government, our city and county government. We had members of those, fiscal court and city council. We have healthcare. Education is part of this, with both superintendents being represented on this. Emergency management, business and industry, and even had the clergy involved. So we had met several times already with all these people, and what's coming with the business grants and some other things we're going to talk about, it's all come from conversations pretty quickly. We got started and got ahead of the game. The first part of lots of what we were doing were answering questions when we sent out all the closing information. Who was an essential business? Am I essential business? So we spent days just talking to governor's office, manufacturing facilities, and finding out who was essential and who was not, and who had to stay open and who had to shut down. So those were some of the things that we spent a lot of time on. And now what we'll be doing is the good news part of it, is the reopening piece. So now we're in conversations with our businesses yet again, but this time on a positive note. When you can reopen, what kind of businesses can reopen? When you do reopen, what does that look like in your company? So the Chamber of Commerce has been very, very helpful with us. They sent a survey out to over 500 businesses here to see what it is they need to reopen. Do you need masks? Do you need hand sanitizers? What is it that you need to get open safely, and to be opening by requirement of the governor's orders? So that's where we are today. We have sent all that information out to our businesses. We've sent them out to our industries. A point of note that our industrial manufacturers, our distribution and supply chain businesses are a little bit different in some of their openings. So we have some separate information that we provide them than what we provide some of the other businesses too, a little more distinct, a little more detailed. So we've got that information out. A couple other things that we are doing right now is we're going to be talking about masks here in a moment. But if you already have some masks and you're wanting to be able to open and be open safely, and making sure that people come into your office safely, we have developed two posters to put on your front door or at the entrance to your business. And a little show and tell here. These are the ones that we're providing. One said, "Mask requested. Should you have a business that you're requiring masks?" We have another one that says, "Masks are required." So these are going to be available at a point where you pick up masks, but they're also going to be available by email. And if you would like to have this emailed, my email address, kimhouston@encita.net. I'm not sure that's coming through exactly backwards, but you can email me and I would be glad to send you a copy of these posters to put on your doors or the entrance to your businesses. The task force continues to meet. We'll be spending most of the time is working with our businesses. Let's reopen safely. Let's talk to the restaurants about a 33% capacity. How does that look? How does that work? So that's probably going to take up the bulk of our time over the next few weeks, making sure we reopen safely and healthy for all involved, Mr. Mayor. But please email me, kimhouston@encita.net, should you have any questions or want any of these documents that we have to provide to the community, the public, as well as the business and industries.
Okay, thank you, Kim. And I would just say also that we are aggregating a lot of that information and posting it on our city website as well. So these executive orders, these guidelines on processes that the governor as well as the president are expecting businesses to follow as they reopen the economy. So there's a lot of, that was again one of our major emphasis for the task force, is to get this information out to everybody as quickly as possible so they would be ready to reopen. Next, I'd like to talk about one of the other things we identified is that there was going to be a need for PPE for businesses and a reliable and affordable source for that, because we've all experienced trying to find them. The availability has been scarce in some ways, and the prices have been out of whack in another way. So I'm going to call on David Mandel, who's a member of our task force, to talk about a very exciting announcement we have today about a supply chain that we're going to be setting up for small businesses, or not just small businesses, but all businesses in Bardstown and Nelson County. So David, if you take over, please.
Thank you, Mayor. Let me just first start by complimenting, the judge, Mayor, Kim, not only for moving so quickly to secure us in this community, but also moving so quickly to open us up in a careful and measured way. And I want to thank all the members of the task force for participating in this. I couldn't be more honored. Our goal in the PPE piece of this was to establish a consistent, secure, and affordable supply chain for PPE so that our businesses and our small businesses can open in a way that ensures that they are protected and that we're offering or being able to provide the guidelines to protect the public as well. As you can imagine, this is very challenging during these times because it is not easy to get the type of PPE and the quantities at the price that we were looking for. I'd like to just tell everybody that we did accomplish this in record time. We're very excited about it. And I want to thank the YPO organization as well. This is a global leadership group of more than 29,000 CEOs across 130 countries, which I happen to be a member of. And we reached out to the YPO network. YPO member Viraj Gandani, who is the founder of Medivant Healthcare, and they are a pharmaceutical manufacturing company in Arizona that are working to bring back generic drug manufacturing to the United States, answered the call, and they provided us with a stable, affordable supply of the protective masks. Those masks will be arriving here on Monday. We were able to secure an initial order of 100,000 of those masks at about a third to half the price of what they are going for in many other instances. So we're able to do this, and we're very excited about being able to offer that to the community. And the mayor will be talking, and the task force, a little bit more too about how we're going to go through that process of distributing and making them available to the businesses. But it's a very exciting development.
Thank you, David, and our hats off to you. And you worked tirelessly over the last 2 weeks to work your network of people that you know that are in this type of business and so forth, and it's paid off. I mean, for us to be able to wire the money yesterday and have these masks delivered on Monday is a testament to the hard work that you did and others did. So we're really grateful on that. I would just like to say how we see this happening. We don't have the full details yet, just because we just literally got the source nailed down and money wired yesterday. Thankfully, we've got some donors that are supplementing this, as well as fiscal court is putting up the seed money for this effort. And as a result, we'll be able to provide these masks, as David said, at a very discounted price. The way it looks like we plan to work this is that businesses will make a formal announcement probably either later today or on Monday through the email communication that Kim referenced, and also on Facebook and so forth. People will be instructed how to call City Hall, place their order, make the payment via credit card, and then we will supply them with a receipt. The orders will be sent to the Nelson County EMS out on Atkinson Hill Avenue. I think that address is 1301, and Joe might correct me. So the orders will be sent out there, and then we will have a more detailed message on the distribution and pickup and so forth on that as we work those out later today. So it's exciting that we'll be able to allow businesses to purchase up to 1,000 masks. We think the price was going to be closer to 50 cents than what other businesses have been paying. I think we've heard everything from $1.40 to $1.75. So it's a big discount. And we also want to encourage, because of this pricing we're able to do with the cooperation of these donors and fiscal court, is we want to encourage our businesses to have extra masks on hand for their customers. Just like Kim said earlier with these messaging signs, we want everybody to have access to them. And we think a great way to do that is through our businesses by offering complimentary masks for anybody that doesn't have them. And we hope that way we'll get more and more out to the public. So more on that later today. Kim, I don't know if you or Judge want to add anything to that discussion, or David?
I think you handled it, Mr. Mayor.
All right. I'd like
Other than
to
the fact
call
that
on-
Mayor, if you allow me to, also while you're talking with about the mask, David, I want to thank you as well as the mayor just did for your efforts in securing that PPE, and the mayor will have that posted here shortly, and fiscal court members have been made aware of that, and we hope to be able to turn those and keep a supply of those as it goes forward too.
That's correct. So I'd like for you, if you would, Judge, if you've got some other remarks you'd like to share with us today.
Yes. As you, if anybody had a chance last night to watch the governor's press conference, he gave us some new dates on some other openings that should happen in later, some in May and on into June. And one in particular that we're interested in, actually had a staff meeting on this morning with youth sports. We have to determine if the youth sports, then basically less contact, non-contact sport, but the only sport anymore that's non-contact, and that's about baseball. Soccer is rougher most time than football can be sometime, but that's for later on anyway. We hope to be able to deal with that at a different time, but we'll have some guidance come out. We'll take the governor's guidance and develop plans for the June 15th youth sports league if necessary. We may or may not be able to do that. We're leaving it up to the leagues, or contacted the leagues, or getting ready to contact the leagues to come up with their plan of how they can safely monitor the sports leagues themselves, and including the concessions. And by that time, some of the restaurants will be open as well. So it all kind of fall into place. It's going to turn out to be a pretty good plan. Just a couple of comments, if I could, on the 30 cases that's been reported in Nelson County so far, that 73% of those cases are females. And I find facts like that interesting. And Katie and I were talking last night. The fact that 73% are female means that the female goes up to the grocery more, goes out to the other place. They're more involved in being out and about more. So, but statewide, there's only about 3 or 4% difference in the male and the female. So I just find that very interesting. And I will make another comment about percentages. Since more testing has been in place for the last 10 days from the state level, the state of Kentucky was averaging about 8.4% a positive test. Now with more testing involved, we're down to 7.5. So the rate is dropping some with more tests, and that's all positive. And I'm sure it's good news to the governor that he's trying to make the right decisions and open gracefully. Masks are important in staying open. Now, it's one thing to open up your businesses, and it's another thing to have a major big spike in cases, and the governor has to redo this again. I'm sure he does not want to do that. Nobody wants to do that. So as much as possible, wear your mask. I'm sure we're going to get some kickback on that from a lot of people, but wear your mask, wash your hands, and do the sanitation that you need on your places of business once you open. I think most people will do a good job. There will be some rebels, and those rebels will cause some problems for all of us. So, and if you saw last night in the governor's press conference, the new place of testing was First Care Testing, right out here by Lee's Fried Chicken. And the mayor may get into that a little bit more later on, but that is great news. And the more testing we have, the better that our employees, once they get to feeling sick, we can find spots for them. It's been tough to find a spot or two for certain individuals, not our employees, but some people just don't know how to go about the testing process. And it'd be nice to have these new places. That's all I have today.
Thank you, Judge. And I've got some prepared remarks that we put together, really, which is kind of a synopsis of the meetings that our task force has. So kind of bear with me. I typically kind of fire from the hip a little more, but we wanted to capture a lot of the discussion and the planning and the outcomes of this effort from the task force. And so at the outset of the COVID-19 pandemic, Bardstown and Nelson County was at the forefront to try to contain the virus. We moved quickly and safely to close businesses in order to reduce the threats of the deadly virus. Today, we face a new challenge. How best do we follow the guidance of the governor's phased plan of reopening and return to work? Once again, Bardstown and Nelson County will take a proactive role in this phased in return to work. First, the city of Bardstown immediately put together a joint task force to provide a roadmap for a responsibly and safe reopening and follow through. The task force was instrumental in developing a strategic plan for Bardstown and Nelson County in relevant areas. One of the areas we really emphasized that we needed was more and robust testing, and we're happy to report increased testing has been announced at Flagey Hospital, Hardin Memorial Health. The judge and I have been working with the state, and we should be hearing something from the state in the near future. Yet another drive-through testing site will be announced. Hardin Memorial Health has a drive-through, and also, as Judge mentioned, First Care. And I've been in conversation with Hardin Memorial Health the last couple of days, and they asked me to kind of make a formal announcement on their efforts here at their clinic here in Bardstown. The Hardin Memorial Health Bardstown Family Medical Center, located at 3615 East John Rowland Boulevard, is offering COVID-19 drive-through testing Monday through Friday, 8:30 to 4:30, and by appointment only. Testing is available for individuals with symptoms, first responders, and healthcare workers. To schedule an appointment, call 502-348-5968. Dr. Monarch, is there anything to add to what is currently going on at Flagey that we need to share?
No, we are working with the state through using their gravity testing partnership the governor's spoken to, and this may be what Hardin Memorial is looking at as well. But we feel that our testing capacity of anybody that's symptomatic that approaches our healthcare system, they get an immediate test without any problem. So we feel good about our testing.
Thank you. You know, testing is key. I mean, yes, you find out today that you're not sick and you might get sick next week, but the tracking portion of this and the quarantining portion that can come from those positive testing will help reduce the chance for more widespread passing of this virus. The other thing that we worked on the task force was accessibility to a reliable and affordable supply chain of protective gear. And we talked about that, David, in his report. But also, I want to say that with Joe Pruitt working with his sources through the strategic supply chain with the state, our state chamber of commerce has also had a supply chain available, and also the Kentucky League of Cities. So we've been in constant contact with those providers so that we would have a backup in the event that this effort we were trying to undertake at the task force level was not able to be put together. So we always wanted not to just put all our eggs in one basket. We wanted a backup in order, particularly for these first responders and our hospitals to have. Affordability was obviously the key goal besides reliability. And as you can see, we're providing these at a cost well below the market. And we wanted to be accountable and also transparent. And we feel like that since the start of this, the first responders, the judge and I, the city, and many others have tried to provide a lot of information to the media, that we could get this out both through press releases, Facebook posts, and so forth. And we've also now included and gotten the chamber involved and Main Street involved and the BIDC involved. So we're trying to be as transparent and accountable as we can. It's important to stress, though, even though we are easing the restrictions for Bardstown and Nelson County, it doesn't mean that any of us can lose sight of the safety measures we have employed up to now. And it's just the opposite. We must continue our current practices. And we've talked about that with making sure we get this information out in front of the business owners so that they can safely open their businesses. Because as the judge has talked about, and Dr. Monarch and David, we're all really taking a leap of faith here. None of the cities and counties and states are really met the guidelines that were announced early on that should be met in order to gradually reopen our economy. And that's the 14-day continual decline in the number of cases. So it's imperative, to stress what Judge Watts just said, that we continue to do all the things that have been put in front of us, and for businesses to access those guidelines so that they can safely open the economy. And then we as individuals want to be safe as best we can. And again, we want to encourage businesses to try to take advantage of these inexpensive masks and have them available for their customers who may not have them. These recommendations will remain in place, not just for us and our loved ones, but to demonstrate to others that Bardstown is serious about the health of its citizens and those that visit. Again, that was an important part of the task force, that we just didn't want to sit back and just wait for what the state might send out to us and what we could find piecemeal around to supply the PPE that was necessary. We wanted to be proactive, and I think we have. I think today's announcement demonstrates that. And hospitality was another part of this. We wanted to be able to get that message out that once the restaurants are able to open and the attractions are able to open, that Bardstown and Nelson County aggressively worked to help these businesses get open in a safe manner. And so that Bardstown will be a safe place to travel to in the near future. And we think that, probably travel by car and RV and motor coach is probably going to grow, and maybe travel by air might decline. And I know Kim and the Tourist Commission are already working on strategies for marketing to the hospitality market in different ways now, because this has influenced that as well. But we want that message we can convey, that we are a safe community, we're a safe community to visit, and we will take care of you when you're here. And no one can guarantee the future. We can promise to move forward. And as we have since the pandemic arrived, we're dedicated to Bardstown and Nelson County and our environs. And we're committed to ensure that we'll be stronger and safer and prepared going forward. And, I think we all feel really good about what we have done with the task force and all the efforts that came prior to that. And it's been a collective effort. But, the way I look at it, today is not a day for celebration. Today is another day of preparation. And it's going to take a lot of preparation for us to be ready to reopen our economy. And I hope that everyone will work with us and help us accomplish it. And we get back on our feet. And that's been the goal of everybody and do so safely and protect our community. Before I open it up to questions, I would again want to thank the task force for their efforts. It's been remarkable that we've done so much in such a little amount of time. Fiscal court and Judge Watts has been a great partner to work with. Certainly our health experts, Dr. Monarch, Joe Pruitt, and Dr. Smith. It's been great to have you all be able to guide us, particularly on the health and safety side of things. Certainly want to thank the city council for their commitment and effort. Some of them served on the task force and they've made a huge financial contribution to these efforts. And a lot of the city staff have helped tremendously. Our work is going on every day like normal, but I've been counting on them and depending on them to get so much of this stuff ready to get out to the public and put together the plans that we need. Excuse me. And I want to thank the media. I know you all have been there. Anytime we've had any information, you all have been great to work with in getting this out. And it's important that we get this out. We can't just do it, just do a Facebook post or whatever. So we really appreciate what you all are doing. And I know you have called on a number of us to do interviews and so forth, and we'll continue to try to do our best to make sure you get information on a timely manner. And finally, we still got to take our hats off to our first responders and health providers and people in the hospitals, the people that are providing the ambulance services and our police and fire departments. They've just been terrific. We're blessed to have so many first responders available to us in a city like Bardstown, and a county like Nelson. So we thank you all very much. So with that, I would open up to questions. I think the group's here to answer those as best we can. So I'll ask WBRT, if you're on the thing, if you would like to ask any questions. What about Jim Brooks? Are you on the call?
Yes,
Would you like to ask any questions, Jim?
yes, sir. Regarding the supply of masks, how is there any anticipation on how long 100,000 masks will last in our community as businesses reopen and need the PPE?
Kim, you might talk a little about the Survey Monkey. It appears, I'll let you speak to that if you could, and anybody else.
Sure. We have surveyed a lot of our businesses, and what we're finding out that there's still several businesses that were able to remain open. A lot of our newer, larger manufacturers, of course, and they already have a supply of masks. They have a supply of gloves. One thing we haven't mentioned, and I want to specifically mention, is Beam Suntory truly stepped up for us this year too. We're not only going to have masks, but we're also going to have hand sanitizer to be able to distribute to our businesses as well too. So that's another addition to the PPE that we're going to provide. But what we're really finding out that our smaller businesses, when I say smaller, I mean businesses 25 and less employees, really haven't found that supplier yet. So they're looking for us, and they're going to be the ones probably that are going to be coming to us to get this supply. So we're thinking right now, according to the survey that we sent out, about 75% of the small businesses are looking at us to probably provide them 25, 50, 100 masks at a time right now. We think we've got a good supply, but if we not, we know David Mandel has found where to get it. We can get more and we will not run out. We'll continue to be able to provide these at some point in time to our businesses. But it's going to be mostly for the small businesses. So we're really, really going to have the media to help get that word out for us.
All right, thank you, Kim.
Jim, one other thing, I would say that our goal is we don't plan to be in this business for many, many weeks or months. Our goal, again, of the task force was to do everything we could to help get people ready and prepared to reopen, which is, a phased in approach over the month of May. So we envision this to, for sure, maybe have enough to get us through the month of May, excuse me, to help us reopen. But we don't plan to be a permanent supplying source if this, lasts for several months.
All right, thank you, Mayor.
Kentucky Standard or PLG, do you all have questions?
Yeah, I have a couple. This is Forrest. One question I had was, and it has to do with the masks, and I think the judge, can everybody hear me?
Yes, sir.
Yes.
The judge, I guess, alluded to this about kickback and resistance to wearing masks. What should a business do if someone refuses to wear a mask when they come into the business, either a worker or a customer?
Well, this is Dean. The governor gave a little bit of guidance on that the last few days. Not directly, be honest with you. It's up to the business themselves, the business owners themselves, to how far they take that. If you'll notice, Forrest, I did this morning in the Costco company. It has implemented a policy: you don't come in my stores unless you have a mask on. And of course, they're taking some hits from verbal hits from a lot of people, but that's Costco's decision to do as well, because they're nationwide. But as far as Kentucky, the governor's recommending, some people saying the wording is probably a little too strong in his guidance. I have not read the guidance completely yet, but it is going to be interesting how we handle that individually. Most certainly, wearing a mask is for protections of the other people, not necessarily yourself. And like the governor said, you're supposed to be a good steward of your community and wear those masks. But yeah, there's going to be resistance, and there's going to be people not going to wear them, period. You can write that down.
Can I add one thing to that, Mayor?
Sure.
Sorry, and Judge. I think that both the mayor and the judge and the team here anticipated some of this, and that is why we are really working to get businesses to have an adequate supply and an easy supply of these masks, so that they can give them out to customers, so that they're not just, if they choose and they decide to have it as a rule that you need to have a mask, when somebody comes and they don't have a mask, we have disposable masks available. So it's another way of trying to diffuse that type of situation for us. And our goal here as a community too is to encourage people to change behavior. And it's not forceful, it is by doing everything that we can to encourage people to engage in safe practices.
Yeah, David, that's exactly that. For us, that was a major point of discussion by the task force, and we always said that we should err to the decision of the business owners as to how they want to enforce that. So I think that's how it's going to play out. I think David is dead on what we want to do. Hopefully, is change the culture here to where people understand that as businesses open up, there's a lot more exposure going to be out there, and these numbers are going to go up with more testing, and the chance of transmitting this is going to go up. So a mask is really a major line of defense here, and we hope people will embrace this idea.
What are your thoughts, Forrest, on that?
Well, I'm just asking because if I'm a business owner and I put up the sign saying businesses saying you are required to wear a mask, and then I got that one person who comes in and says, well, you can't make me wear a mask and I'm not leaving. What do I do? I mean, that's a point of confrontation right there that a lot of people will probably be uncomfortable dealing with. So at that point, what do? Do I call the police? I'm
going to research that further, Forrest, as the governor, through the directives under the statutes, has the authority to make it mandatory. I have not read his guidance on that, and I'm getting some kickback already from some businesses that have read some of this stuff overnight, and I have not read it thoroughly. I think some of the language in the guidance is almost like a mandate. So I need to read that, to be honest with you, and see if the health department is going to enforce that. Health department has the statutory authority to provide enforcement for these regulations or guidances. It depends on how it's labeled.
Right.
Oh.
And my question was more geared toward, if I am a business who agrees with the need for the mask,
Yes, yeah.
is there going to be assistance for me if I have a person who refuses to wear a mask in my business?
Good question. Great question. And we need to think through on that. Yes.
And as far as this, David, I would, recommend that we kind of focus on the issue of, having the PPE supply ready for the businesses. So if these issues do come up, that obviously the easiest way to diffuse situations is by asking somebody, to put one on, having it available for them, and it's something that they're not, that is free to them when they come in. So there are obviously a lot of different ways to diffuse these issues between that and, having to take the ultimate action. So I think the thing to focus on here is that we're doing everything we can to make sure that businesses have lots of options and be able to diffuse the situations, and we don't let the exception, drive the rule. I think it's easy to focus on, some of the more, adversarial potential issues here. And let's focus on, what we can do together as a community to try to encourage the right behavior.
Thank you.
Thank you, Dave.
I have one other question. And I think the mayor referred to this, and I just wanted to get the reaction from any of you on here. According to the original benchmarks that were set for reopening, we haven't met those. And obviously those were made a while ago, and things changed through this unprecedented time. But what are your reactions to that? That we're all looking at, the benchmarks were set, and then we haven't met the benchmarks, but we are set on reopening. Just what's the reaction from anyone out there about that?
Forrest, this is Dean. I've watched that very closely the last 2 or 3 days. In particular, the media in attendance with the governor's press conference has pressed him on that as well, and found that it's in a tight spot. You are right, the benchmarks haven't fully been met, but I do believe with the increased testing capacities, which was one of the benchmarks, the opening dates that the governor has set forth here, we will get close to that 2-week benchmark, that 2-week decline. We've already gone, and I've been monitoring this on a daily basis. We have gone down 0.9 of a point in the last 8 days, 7 or 8 days, and so increased testing will allow that to continue to show a decline, because you're able to show that the virus is somewhat, it's out there, but the numbers will go down. I truly believe that. They're already down 0.9 in about a week, 10 days.
And then, Judge, I'd like to kind of speak from the healthcare perspective. Sure. in terms of the phased reopening of healthcare. One of the concerns why I think I'm in 100% support of what the governor is doing in terms of opening up healthcare, and businesses are a little bit different. There's different aspects and different challenges, but from our reopening, what we found in the hospital is that obviously everybody's concerned about having the capacity, the hospitals and the healthcare systems to manage these patients who have the coronavirus if they do need care outside the house. But what we're kind of, from the physician's perspective, and this is what other situations are patients' conditions not being addressed that are just as important and concerning as the coronavirus, such as heart attacks, strokes, necessary surgeries, whether they need to be done, like gallbladders, that they don't, you're probably not going to die from that, but it, it causes some significant morbidity and complications for the patient downstream, and the patient's ability or desire to seek care in those situations. So one of our concerns, not necessarily here at Flash A, but just from the entire medical community across the nation, is what type of all-cause mortality that we're going to see across the nation from this. And what that is it's a statistic that it looks at all deaths and all, or really all deaths that had arisen during this period. And a lot of that's going to be because people have not sought care in our healthcare, in the healthcare arenas like they should have, such as the people who've had chest pain, who don't want to go to the hospital, or people who have stroke-like symptoms, who stay at home and it gets better and it causes problems later on. So at least from our perspective, we feel like that we can safely protect the patients. We can adequately take care of those patients who do need our care, whether it's from the coronavirus and other conditions. So from our perspective, I feel like it is the right thing to do, because there are other concerns and patients issues other than the coronavirus.
Thank you, Doc. Forrest, my comment would be, as I said earlier, it is a bit of a leap of faith, and it's happening all over the United States. But I think it's sort of a compromise. It's a combination of, we've had these rules in place that all the essential businesses have now been open for 6 weeks, practicing all the social distancing and the hygiene and so forth. But the new rules that the governor has set out, and actually the president's task force as well, they are more strict on businesses, and they apply not only to those that were essential when they first opened or stayed open. They're stricter, and I'll just point out a few things. On-site temperature checks, health checks, universal mask and PPE. The masks weren't required in these workplaces. From a practical standpoint, most places that really needed them did use them, but they weren't required. They're asking you to close common areas, limit face-to-face meetings, and still telework where possible. You're going to have hand sanitizing stations in your areas, both for your employees as well as your customers, and other special accommodations. So actually, the rules are stricter, and also I think it's just the reality of the economic forces that are pushing as well. So that's kind of how I've seen that there's been sort of a leap of faith here, and putting stronger rules in place. And we have to depend on our businesses and corporations to do the right thing. And if so, we can hopefully maintain the virus as best we can.
Mayor, also for the healthcare perspective, just to answer Forrest's question another way, these goals have to be fluid. They cannot be strict. You've seen them change their mind on whether to use masks in public before as opposed to now. All these things are because we haven't been through a pandemic like this for a century. So they have to be fluid, and you have to respond to a lot of different things and try to make the best choice, but you have to be willing to change that goal if it looks like that goal is unrealistic or it's not going to be meetable.
And to follow up with Dr. Smith's comment, he's exactly right. I think one of the things that we've seen is how the governor is reporting out each night in his press conference is the number of open hospital beds, the number of open ICU beds, and even though we've not seen a decline in overall cases, we're kind of at the plateau. The healthcare systems across the state do have the capacity at this time to handle any healthcare need that arises. Now that may change quickly, but at this snapshot, we are able to handle it. And I think that was one of the bigger concerns. What it started all this is that the healthcare system does simply not have the capacity, the number of beds and ventilators, physicians, nurses to handle that. And right now we can.
Mayor, could I speak a little bit to his first question on the mask?
Sure, Joe.
Forrest, I think the task force goal here was to set an example for the general public by providing the mask. I think as it goes along, as healthcare and first responders found very quickly that we didn't want to use masks and didn't want to use them in the amount of time per day or per shift that we do, but we knew we had to. We were protecting the public, and it became an accepted normal. And I think our goal is to make this an accepted normal for the general public now. I know in other states where masks are required to go in businesses and in general moving around the public, that it's the normal is using a mask. And when somebody doesn't have a mask on, it's out of normal. And folks look at that person very oddly. So I think if we lead by example, like Judge Watts alluded to, there will be rebels, there'll be folks that'll be resistant, but they will ultimately be the minority in the end. And our goal is to protect the public we're coming in contact with.
Thank you, Joe. Forrest, any other questions?
No, I'm good. Thanks a lot, Mayor.
Thank you. Do we have any other media on the call or the meeting that would like to ask any other questions? Okay, well, listen, I want to thank everyone from our task force who participated today, and certainly again, thank the media. You all have been important to us, and I think you've done a really good job on getting our messages out, and I know you will do so from today's meeting, and we hope it's going to be beneficial to the community to know the work that's going on their behalf. So thank you all very much.
Thank you, Mayor.